Hi. Hi, welcome to the mental wellness journey. Discover the underlying causes of your emotional and physical symptoms and finally heal. Today, I'm ecstatic to have Dr. Christina Bjorndal, who is a naturopathic physician. And let me read a quick bio. She is an authority in the treatment of mental illness such as depression, anxiety, bipolar disorders, and eating disorders. Having overcome many mental health challenges, Dr. Chris is a gifted speaker and writer who loves to share her philosophy of wellness in interviews with icons like Jenny McCarthy and many more. She is recognized as one of the top naturopathic doctors to follow by two independent organizations. Dr. Chris has helped many patients achieve physical, mental, emotional, and spiritual well-being. She has completed 3 books on mental health, as well as a 10-week course, an in-person retreat on mental health as well. And she can be found at drchristinabjorndal.com. So thank you very, very much. You are the epitome of what I'm trying to do and communicate to people. So I was very pleased to find you and that you could agree to do this interview. Because my understanding is you've lived and this is your entire life, discovering the underlying causes of mental or emotional symptoms.
Mm-hmm. Yes.
Can I ask how you came to the field? Because we all have unique stories that tell a lot, that really inform people who get to know us.
Mm-hmm. Yeah, absolutely. So, I haven't always been a naturopathic doctor, and I came to become one through my own struggles with my mental health. And those started pretty much in high school when I developed an eating disorder. And an interesting side note about that is in the year prior, I was treated with antibiotics for several months to treat acne. And this was back in the 1980s and the mid 80s. And so there really wasn't any conversation going on at that time about the relationship between the microbiome and the brain. But now we know that there is this interconnected relationship. So that's just an interesting thing to keep in mind. I then continued that bulimic behavior through to university. And then when I was in my 3rd year of university, I found myself in a place that I'd never been before, which was debilitated with depression, having suicidal ideations, and extremely, extremely anxious. And I was prescribed antidepressants, which I took. And then about 3 months after that, I found myself in another place that I'd never been before, which was having basically a psychotic event. It took 6 people to wrestle me into a straitjacket, and off I went to the rubber room at the hospital where I was injected with haloperidol and left to come back to reality. When I came back, I was diagnosed with bipolar disorder type 1. And what I did with that is I pretty much stuffed it in a place that I didn't want to look, and I didn't want anybody to know. I felt a lot of shame and a lot of stigma about that particular diagnosis. And I just marched on through the world wearing, and the mask that I usually wore was, I'm okay on the outside, but I'm not doing that well on the inside. And I was an overachiever, so I just continued this overachieving tendency into my working career. And then 6 years into that, I was still struggling with anxiety and depression primarily. And I ended up having a suicide attempt, which left me in a coma with kidney failure. And I was on dialysis, told I would need a kidney transplant. And that really was the turning point for me, because when I came out of that coma, I wasn't happy about it, that I was still here and that I had been unsuccessful. But I realized that I needed to figure out another way to navigate my mental health challenge, my mental health journey. And the way I was doing it, which was basically being at war with myself and really not liking these different aspects of myself, was not taking me to a place of healing and recovery. So that's really how the journey started. So I started to see a naturopathic doctor. I started to see a psychiatrist who was nutritionally oriented. His name is Dr. Abraham Hoffer. He worked with Dr. Linus Pauling, who won 2 Nobel Prizes. And I began to feel free of depression and anxiety when I started this nutritional protocol. So then eventually, after asking myself and sitting with this question, which was, if money didn't matter, what would I be doing with my life? The answer that kept coming up for me was to go back to school and to go on to study nutrition and naturopathic medicine so that I could help people the way that I felt I had been helped. And so that's what brought me to here.
This is an amazing story, first of all, and powerful. But I do want to interrupt because I'm somewhat older than you, and naturopathic physicians weren't on my radar at all. When I decided to go to medical school, it was in the mid-1980s, and I don't know why. And I know now is the internet, so there's so much more resources, but how did you become familiar, or was that something that you were already familiar with?
No, I hadn't been familiar with it, but it was a friend. I had a couple of friends actually who were familiar with it and who were very, one of my girlfriends, her mother had passed away from cancer when she was in grade 9. So she was always very paranoid about, anything that was chemically oriented. And so she had an extreme bent towards the natural side. And then another close friend as well, who was a nutritionist, who felt that I really needed to look at things from a different perspective. And so I had never heard of it. I had never heard of, and I was quite, to be honest, I was quite resistant to this approach initially. I was quite skeptical. But I figured, well, I've got nothing to lose, is basically my approach. I mean, I was at the bottom and I had nowhere to go. I didn't think I could go any lower than I was. So, I only felt the only option for me was to go up.
And Abraham Hoffer, again, not until the last 10 years have I become familiar with him.
Yeah.
So that's another. How did you find yourself?
Yeah. So interesting. So yeah, so that my friend Lisa, who is the nutritionist, I was also unhappy in my role, in my work. I worked in the banking world. I reported to a CEO. I had a high profile pressured job, and a lot of people, on paper, I looked, it was a great job, but for me, it was, not necessarily right for me. And so we were trying to figure out if we could develop an organic baby formula together. And through the process of looking into this, we ended up going to a health food store trade show, and I saw a flyer for this Mental Health Regained public forum. And so I thought, well, I need to, at this point, I didn't fully have my mental health regained. And so I went, and that was Dr. Hoffer who was speaking.
Wow.
And so I went, and I actually brought my dad with me. He came with me, and we listened to the lecture and talked about, nutrition and how amino acids and magnesium and B6, and just basically how our body is made of nutrition, and that's what we need to support our neurotransmitters and hormones. And so I actually went back to my psychiatrist, asked for a referral to see Dr. Hoffer. He wouldn't give me one.
Is that something?
So then I went back.
Is that something that's needed in Canada?
Yeah.
A direct referral. It's not like here where anybody can refer themselves to anybody.
No, for psychiatry, you have to go through. Usually a general practitioner, or I think another psychiatrist could refer you to another psychiatrist. So I ended up getting a referral, and then I went to see him, and I was very, very grateful for that opportunity, because he really, really was in a category all of his own, and so I'd encourage people to, he has passed away now, but I'll never forget when I actually laminated his prescription that he gave me, because I hold him in, very high regard. So, But he said to me, are you okay with feeling better and living longer and looking younger? These are the side effects of these medications or these supplements that I'm going to
Right.
prescribe for you, Yeah.
Yeah,
So,
I've trained with Dr. William Walsh. And
yes.
he's
Yeah.
going to be on this series too.
Yes.
I
Yes.
want more and more people to understand or know this.
Yeah, that's right.
So back to your story. I'm sorry, Anne. So you became a naturopathic physician. That's quite a big undertaking
Mm-hmm.
as a second career.
Yes. Yeah. I had to go back to high school because when I was 33, because I didn't do sciences the first time round.
Okay.
And so I went back to high school to upgrade the sciences and then to back to UBC to do the undergraduate science prerequisites and then to naturopathic school. So it was a huge undertaking to basically stop and do a complete 180 in the middle of, in the middle of my 30s and then to embark on a brand new career. But I was in a fortunate position because I was single and I had no children and, I really had nothing to lose. And so
But still takes
I
a lot
moved
of
forward.
passion and determination to
Mm-hmm. Yeah. Yeah, it wasn't easy. I can tell you that much. It certainly was not easy. And there's something to be said when you're younger too, in terms of, it's a lot of material to study, it's a lot to learn. And I really had one singular focus. I just really wanted to help people with mental health. And that was really my main, I wasn't as interested in working on, treating somebody who has rheumatoid arthritis or who has eczema, right? So for me, I had a very singular focus and intent for why I was going.
And so bring me up from finishing naturopathic school. What kinds of people have you worked with and helped?
So in practice, mostly I'm working with anxiety, depression, bipolar disorder, eating disorders, mostly with bulimia. I don't really work with anorexia. And people who want to lose weight. I work with patients who have addictions and then schizophrenia. So basically and ADD, ADHD as well. Just autism and is the main one I'm not involved in as much.
Yeah,
Yeah.
it's definitely a specialty of its own once you
Yeah.
get to this. And maybe you can share a little bit of your approach.
Mm-hmm.
And I think also the label, because one thing when I went into the functional medicine world, well, I've always been oriented this way, really not enjoying or not finding the usefulness of labels of depression, anxiety, bipolar disorder, schizophrenia, because people really, there's so much stigma attached to them.
Yeah. 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 And that's why I've called my book Beyond the Label, because I feel like, well, exactly like you said, that people get stuck in the stigma. I know I was really stuck in the stigma, and I just wanted people to know me for me, not, because,
Exactly. Well, you
I
are
have,
right.
right.
Everybody.
Yeah. Yeah. So for me, I like people to understand, and I explain that, really this is the full range of human experience. And while it may not be fun, and I know it's because I've been there, it is not fun to be at the bottom of the barrel with suffering from suicidal ideations and living in that space. It's not fun. It's also not that fun, I don't think, to be losing your mind in a state of delusional psychosis either. But I think that to label those as abnormal, it does a disservice to that individual. So it's just that it's the full spectrum of the human experience, and people are when you're in that manic state. I mean, definitely you're vibrating at a different frequency. And I'm not saying that it's fun or that I think everybody should be there. I don't, but I also think that by saying that's abnormal, or that makes you feel like there's actually something inherently wrong with you, right? And I just think that it's just the range that the human can experience.
I can't agree with you more. And
Yeah.
I've always felt that way instead of, yeah.
Yeah, and usually there's something behind that, right? We always have to ask, well, what's behind the behavior? What's behind what that person is experiencing? And is there been a trauma? Is there
Mhm.
a stress? I mean, Dr. Hoffer, he talked about and this was in the 1950s, and I know that it may have since been, I have to look further into this, but he talked about the adrenochrome hypothesis,
Mhm.
and that how with psychosis, it's like adrenaline, your body produces too much adrenaline because there's a stress or there could be some sort of trauma. And in some people, they just can't break it down. So there's this intermediary byproduct that's called adrenochrome, and it contributes to psychosis. And I know for myself, I have had 6 psychotic events in 3 years.
Mhm.
And every single one of those, there's been a lot of stress going on. So it's the key question that we want to be asking people is not what's wrong with you,
Thank
but
you.
but what's happened to you,
Mhm.
right? And I think if people had asked me what was happening, they
Mhm.
might have been a little bit more compassionate and understanding.
Yeah,
So, yeah.
that's my bone to pick with the conventional mental health world here in the States. It's very stigmatized and judged as opposed, it's your, in addition to what's happened to you, probably some genetic vulnerability that it manifests in the brain.
Mhm. Yeah. Yeah, and then there's this whole field of research about epigenetics, right? So it's like, okay, the genes load the gun, but lifestyle pulls that trigger. And so what is that environmental influence or perhaps stress that turns a gene on or lights a gene up, right? There's been studies done of twins, identical twins who have been adopted, and one twin develops a mental health disease or condition and the other one doesn't. And you would think, how do you explain that? Because if it's all about the genes, then they would both have developed it,
Right.
but they don't. So it's this epigenetic influence that's really important to keep in mind. Because I say to my patients, a lot of people say, well, it's genetic, right? There's nothing I can do about it. And I feel like that leaves you in a victim position. And
Our system tells everybody too.
it does. I know for me, when I first asked, why is this happening to me? That's exactly what my psychiatrist said to me. He said, well, Chris, it's genetic, nothing you can do. And I'm adopted, so I couldn't look to my left or my right to verify the truth of that. So I didn't accept it as the truth. And so I think it leaves people feeling like they're a victim, like there's nothing that they can do. And I'm here to share with you that there is something that you can do, and you're not at the mercy of your genes. So there's things that you can do to help yourself, especially with depression and anxiety. So
So yeah, like somebody comes and sees you, what kinds of things will you do with them?
mhm.
'Cause-
Yeah, first thing I explain is that there's 4 aspects to you as a person. So there's the physical, mental, emotional, and spiritual. And our Western system focus mostly on that physical level. And I
Mhm.
think, again, if that's all you're going to look at, then you're going to miss 75% of the puzzle here. Now, in order to build the right foundation, we absolutely do have to look at that physical level and understand that there's 3 macro systems in a sense within each of us. So we have our neurotransmitters, then we have our neuroendocrine or hormonal systems, and then our organs of detoxification and our immune system. And all 3 of those can result in, like if there's imbalances in them, can result in symptoms of mental health issues. And I know for myself, I had to work on all 3 of those macro
Mhm.
systems. So then I build in on the physical level. I build it, first of all, figuring out, well, what's happening, especially from a female perspective as well. If things started to happen around the menses, then
Mhm.
that points to hormones. Or like in my case, when it started to happen in university, when I was an overachiever, basically with the benefit of hindsight, now that I have a bit of knowledge, I think what happened to me then, why I crashed, was I basically crashed and burned because I was burnt out, right?
Mhm.
I was burning the candle at both ends, being top this, top that, trying to prove my worth to the world. And I basically ran out of gas from an adrenal perspective.
Sure.
So And you see that it's really common. You see that in university students, and they're all prescribed antidepressants, but I don't think that that's the root of the problem. You
Mm-hmm.
know, we always want to be thinking about what is the root or roots of what do we need to be supporting in the body.
Yeah,
Um,
antidepressants, people kid, you don't have a Prozac deficiency. Um, but the point is the medicines have been very helpful for some people, but it's one step in a long process prior to that step and after that step, because each medicine definitely has side effects too.
yeah, and and I am not anti-medicine at
Mhm.
all, but basically I like Dr. Hoffer's approach with it. He said, you know what, Chris? He said, let's use. So for me at that time, it was I think it was Prozac that I was taking. You don't want to use it like a cast. So if you broke your leg, you would not wear that for the rest of your life. You would put that cast on and you would wear it for 6 weeks or 8 weeks while the bone mended. So let's do that with the antidepressant. Get you on that, then get you feeling better. And then when you're feeling better, we can work on the diet, and we can work on your thoughts, and we can work on managing your emotions, work on getting the exercise. But it's difficult to do that sometimes for people when you're feeling,
Mhm.
a 10 out of 10 depressed. So, but I think where people are, where the system is going wrong, like you said, is that they're going on this perhaps, and then that's it,
Yeah.
right? That's it. Then you're on that for the rest of your life. Well, no, let's see then what other building blocks we can put in place to support you so that
Mhm.
we could then perhaps transition off. Like, a really interesting thing that everyone should know is that, so for example, Prozac is an SSRI, and so it's supporting serotonin in the body. But what is serotonin derived from? It's it's derived from tryptophan.
Mhm.
And what's tryptophan? Can you make tryptophan on your own? Like, can your body manufacture tryptophan?
I believe it's an essential amino acid, right?
That's right. So you can't. Nobody can manufacture it. So the main building block that you need to make serotonin, you have to get from your diet. And if you're deficient in that, you're going to have a hard time getting to serotonin on your own. And so for me, because I had the eating disorder piece, I had a lot of cracks in my nutritional foundation. Dr. Hoffer put into place all these building blocks to support that serotonin pathway,
Mhm.
which basically goes from tryptophan to 5-HTP to serotonin. But understand that there's nutritional cofactors like niacin, niacinamide, B6, B1, iron, vitamin C, zinc. I think those are the main ones. And he put me on all of those, as well as omega-3s and vitamin D. And the interesting thing was, when I went to naturopathic school, we had to analyze our diets for an assignment in second year nutrition. And
Didn't do that.
you didn't do that?
No. Anyway, it
Yeah,
doesn't matter what you eat. They told me.
right.
Anyway.
Well, the interesting thing was the only essential amino acid I was deficient in was
Wow.
tryptophan. Yeah. So the really interesting thing for me was, as much as I love Dr. Hoffer, nobody in the 15 years prior or
Mhm.
more ever asked me what I was eating.
Mhm.
Right? So we have to be looking at it. You want to understand that everything you put in your body informs your body in one way or another. It's sending some sort of message, either that this is going to support me, or it's going to be work for me to get rid of it because it's not good for me. So
Sequence pathways, right?
yeah. So that's basically, for me, on that physical level, it's really just determining, which one of those macro systems, or again, if it's one or all three, that we're going to be working on. And then starting with the foundation is diet, and taking a look that we're bringing in these foods that are
Mhm.
supporting the various pathways in the body. And then the next area that I think on a physical level that's really important is, especially with bipolar disorder, is sleep
Mhm.
and exercise and managing stress. So that's where I start with people, is giving them, some diet suggestions, putting in doing some lab work again to figure out, again, are the
Mhm.
hormones in balance, what's going on there, and then building in some strategies to get them moving from an exercise perspective, and making sure that the sleep is because with depression, you're either sleeping all the time or you're not sleeping at all. And again, with anxiety, the sleep piece, and with bipolar disorder, the sleep piece of the puzzle is important.
Can we take a little short side trip with sleep? Any pointers for people about sleep? Because that's, I mean, I know we can spend hours and hours and hours discussing that. Like if I walked into your office, it was the first time of us meeting, what would you say about sleep and any specific suggestions for sleep?
Well, first, I would want to know, do you have any difficulty falling asleep or difficulty staying asleep? And also, are you doing anything in your sleep? If you're grinding your teeth or have restless legs or talking in your sleep, those are signs of nutritional deficiencies. So that gives me clues as to what your nutritional status is. And in terms of from a sleep sort of hygiene perspective, we want to understand that from an adrenal gland perspective, one of the things that the adrenal glands really like is rhythm and routine. So going to bed at the same time and getting up at the same time is really important for the health of our adrenal glands. And so encouraging people to do that, and what are you doing in that 2-hour window before bed is really important. So a lot of people are on their iPhones or on their computers or iPads or these sort of devices, and that's actually not good for your health, not only from that blue light perspective, which inhibits melatonin, but also from the EMF perspective as well. So you want to sorry?
EMF being?
Electromagnetic frequencies. Yeah.
Poo-poo that idea, I find. And it is extremely important and impactful that people get to address. So I'm really glad you mentioned that.
Yeah. Yeah, it is a big piece because all of these devices emit what's called these EM. They have a frequency about them which can affect your energy field, and it can disrupt the balance within you. So the other thing that's important about sleep for people to understand is that there is there's a natural rhythm to our bodies, and so cortisol is a hormone that in the morning it should be high, and that's how we're able to just get out of bed and start our day. If you are the type of person that needs to have a couple of cups of coffee to kind of get yourself going, that's a sign that your adrenals are not functioning as optimally as they could. But what you want to understand is that throughout cortisol has a diurnal rhythm, so it's supposed to be high in the morning and then it's low at nighttime, and then it inhibits melatonin production. So if you're doing things like, again, stimulating with the light, if you're engaging in difficult conversations or watching stressful things or triggered by an email or something, that can cause your cortisol to spike right at the time when melatonin's trying to rise, and then sleep can escape you. So just being really mindful of what type of behaviors are you engaging in that sort of 2-hour window before bed. So yeah, I mean, there's so much to talk about with it, but it really depends on what's happening, right? Yeah. I have a whole chapter in my book about sleep. And I think I have in my clinic website, which is naturalterrain.com, I have a download. If you go there under resources and handouts, there's a whole suggestions for sleep there for people to check out. Yeah.
That is so important. So you're addressing the physical level on the 3 different macro systems.
The physical level, yeah. And then I like to get into in terms of the stress management, I'd like to then teach people how to manage their mind so they're not at the mercy of their thoughts. So I have additional training in a few types of counseling therapies, so cognitive behavioral therapy and mindfulness-based therapy and compassion-focused therapy. So I teach a framework. It's called the 7 R's of working with problematic thoughts and breaking the thought emotion cycle. And so what I like people to understand is that we have to understand that we are, like most of us, are living right here from the neck up. And we're discounting our body, right? And as a result, what happens is we have a thought that then, I'll just use from an example that I had to work through myself. So the thought would be, say, I am unworthy, which triggers an emotion like I don't feel very good about myself, which then triggers another thought, well, what's the point of being here? Nobody loves me, which triggers another thought of feeling sad and triggers another thought. And then you just go round and round. And, you stay stuck in this depressive state, perhaps an anxious state, right?
Absolutely.
Yeah. And so this framework, so the first R is you have to question and recognize, what are you thinking?
Mm-hmm.
Like, what is the dialogue that's going on between these two ears? And if it's not supportive of you, then we need to the second R is refrain from following that spiral any further by relaxing into the breath.
Mm-hmm.
And then I teach a breath technique. And just like I said, everybody is living here. They're also just breathing with the top little bits of their lungs.
Mm-hmm.
But our lungs go all the way down to our diaphragm. And when our diaphragm is engaged and it pulls down, sitting right underneath your diaphragm on top of your kidneys is your adrenal glands. And what people have to understand is your thoughts create neuropeptides, which then can affect the hormones that get produced, which then affect how you feel. So it's a little bit of a chicken and an egg problem here.
No, absolutely.
Yeah. And I know for myself, I think I struggled for way too long because I was very resistant to this idea of change your thoughts, change your life. I felt like if you had said that to me, I probably would have rolled my eyes at you and walked out of the room. I really was not open to that idea.
The important thing is those are such common internal dialogues.
Mm-hmm.
And where you were, so many people are at that place.
Yeah.
The world is filled with them. Yes.
Well, and I think the thing for me as well, which is was a bit of a struggle, is I felt like I had to believe those new thoughts, right? So if the problematic thought was I am unworthy, and then the thought you're supposed to change it to, the rephrase is I am worthy, I didn't believe that, right? I felt like that was like spraying a bunch of whipping cream on a pile of bologna. Like I really didn't believe it. So, but that's where I was wrong in my thought process, because you don't have to believe that rephrase thought. You just have to say it because of this whole cascade that can happen in the body. And that's the work of Candace Pert and her book, Molecules of Emotion. So if you're listening to this and you're similar to how I was, and you're like, you're thinking, well, I have to believe these thoughts. You don't have to believe them, really. You just actually have to say them. It affects your physiology in a different way. And if it's too big of a leap to go from I am unworthy even to I am worthy, then just go neutral. Just say I am, right? Don't fill in the blank. Actually, sometimes I challenge my patients to go through a day and just be neutral, because we're very descriptive, right? It's like, oh, the weather is wonderful, or that meal was delicious, or, just try to be neutral. Like the weather is, that meal is, right? Don't give it all these other descriptive labels that we do. Yeah, it's hard to do.
It's very
so that framework has been really, for me, was very, very life-changing, because up until that point, so Dr. Hoffer started me with the supplements, and that got me so far. But then eventually I was bumping up against my core beliefs, my shadow beliefs, my limiting beliefs. And so that's then the work I had to do is tackle those.
Mm-hmm.
And so that's why how I start doing that with my patients is by, first of all, you got to inquire as to what it is that you're thinking.
Mm-hmm.
If you don't know what you're thinking, then that's what we need to start figuring out. And so that's, and so then the rephrase in terms of taking the thought and trying to turn it around, that is really cognitive behavioral therapy. That's what they essentially, you essentially work on. And then I really try to educate people on mindfulness and staying in the present moment, because most people with anxiety primarily are living either in the future, worrying about A, B, C, or D, or we're living in the past. And a lot of people with depression are also stuck in the past. So those places don't exist, the future or the past. They only exist in your mind. And we need to come back to the present moment and affirm what it is you want to have happen for your future. And if it's from the past, we really just need to take a look at what we're holding in the present moment in relationship to the past.
That's
And
a wonderful reframe. I like the way you just said that. Yeah.
yeah. And then try to, again, the past is, it's done. It's not actually happening now, but what's alive in you in the present moment is what we need to work with.
You're making sure we know that you're in Canada.
Yes.
That's great. Anyway, sorry.
Yes. We just had an election, so yes. Yeah. So, and then ultimately what I like to ask people is, how much do you, how do you feel about yourself, right? How much are you loving yourself on a scale of 1 to 10? Where do you put yourself? And very rarely when somebody first comes in to see me, do I get an answer over 5, which I think really
Very sad.
Saddens for sure. Yeah.
And that so many people, that many people, and it's how common it is to not be really very good.
Mm-hmm. Yeah. So that's ultimately what I think we need to start with, right? We need to, we need to work on how you feel about you, because at the end of the day, you're going to be with you longer than anybody's going to be with you. And we have to get that relationship right with ourselves.
Mm-hmm.
And a lot of us have a really strong inner critic that has the stage and is kind of beating ourselves up in our mind. And we need to shift, find a way to grab that hook and pull that inner critic off the stage and let your compassionate side or your inner cheerleader have a say, have a voice. Like I can tell you, with that one suicide attempt that I mentioned, I was just so in my head, very much criticizing myself all day long. It was exhausting. It was really exhausting. And I wish I had, knew then what I know now about how to manage those thoughts. So
that's what you're teaching your patients.
Mm-hmm.
Is to really reframe and look at their thoughts and change that dialogue.
Yeah, that's right. Yeah. So I introduce, are you familiar with Eckhart Tolle, his work?
Not as much as they should be, but a little bit, yes.
Yeah. So I introduce his work. That's really, for people who are listening, just basically the power of now. And, he really is about he had a lot of anxiety and depression himself. And he just learned to realize, again, that there's this voice in this head that keeps talking and talking and talking. And we can become completely identified with this voice. But it's through stillness and through creating a little bit of a separation between these thoughts and moving into the space of stillness or presence that we can then realize that if you can create a little bit of distance, that you can see that you can break out of that spiral that we can get stuck in. So his work has really informed my practice as well. And then the other person who I really like to teach to my patients is the work of Jeff Foster, who really taught me that basically, as I was saying earlier about that whole range of human experience, a lot of times there's these aspects of ourselves that we don't like, love, or accept, which fuels this low self-esteem concept. Mm-hmm. And he sort of referenced it this way. He said, imagine that there's a lost child that knocks at your door. And this lost child is there's the sad child that knocks, and there's the angry child that knocks, and there's the unlovable child that knocks, and there are all these sort of qualities that you don't like within yourself. And if you opened the door and you saw all these children there, would you slam the door in their face, or would you welcome them in? They're hungry, they're cold. and most of us, I think, would welcome them in and give them some love and support. So he's basically saying that that's what we need to do with these parts of ourselves that we don't like, love, or accept. And he says that, you know, depression doesn't need to be healed. It needs to be held within you. Yeah. And for me, that was eye-opening, because I'm guilty of this as a clinician. And I'm sure every doctor that practices is guilty of this. What are we always trying to do when somebody is depressed? We're trying to get them out of that state, because nobody wants to be in that state, and we don't want them to be in that state either. So we want to fix it. But instead, what he is saying is that, you know, sometimes there's medicine to be found within the experience. And so that is, that's an important, a very big shift for some people to make. That part of, you know, I look at all the depressive episodes that I've had, and a lot of them have been the medicine to guide me back to me. Right? To guide me to my heart-centered soul, basically. So I have an article where I talk about this a little that people can reference if they want on, I think it's on the Natural, I have two websites, right? So there's my Dr. Christina Bjorndal, and then there's the Clinic Natural Train, but it's called the 7 levels of depression. One of the 7 levels of depression, sort of where I talk about this idea that maybe, you know, we have two sides of ourselves in a sense. We have our ego, which is, you know, guiding us in a certain regard, but we also have our soul, or our heart, or our spirit. And sometimes depression comes because there's sort of you've got this tug of war happening between these two different masters within you, and you don't know which one to listen to. So you almost get stuck. And I know for myself that has happened in the past, where it's like, you know, my ego is saying, I need to stay at that corporate job. I need to do that. You know, I need to get the pension. I need to, you know, do what, you know, follow the path, right? That's the path, right? But my heart is saying, no, you need to go back to school. You need to go and do this. And it's like, you become kind of stuck. Right. And so
that's such a wonderful framework. And you're articulating in such a wonderful way. And I wish I had those words with multiple clients, as I say. Yeah, because that's so true. But that's such a wonderful, yeah.
So it's just a matter of, you know, learning to tune into yourself. I really encourage people to journal. I know that that's a dying art in, you know, in this new technology age, but there's something about the act of writing that's really important.
I'm curious, when you mentioned schizophrenia and psychosis, you know, as a psychiatrist, it seems so much more potentially problematic. So I'm really curious about your approach to that.
Yeah. So psychosis I find psychosis in the reference of bipolar disorder, I'm going to say easier to deal with, easier to manage, because I feel like it's more of an acute state, and, you know, you can go up quick and come down quick. But I find with
change.
Yeah. But I find with schizophrenia, it's more of a chronic. It can become a chronic thing, and it's definitely more challenging. And I have to say, I think with most of my patients with schizophrenia, medication is required. Like it is required. I've had quite a few. I've actually had one patient who he was fine, and then he had a psychotic event after marijuana use, which I do see that happening.
Absolutely.
It's quite common, and that really terrifies me. But in his case, he seemed to come out of it, and he's been managed with very little. Like, I didn't want him to not take any medication. He didn't want to take. I wanted him to take medication. He didn't want to take medication. But I think that I would say he's regained or recovered,
Okay.
which is wonderful. So it really depends on the case. You
Right.
know,
And the
how
approach is the same, basically.
it is. I mean, Dr. Hoffer talked a lot about with schizophrenia about the leaky gut
Mm-hmm.
piece of the puzzle, and the for lack of a better word, the basically for him primarily dairy and wheat were
Mm-hmm.
big culprits, and so he found that by supporting the gut health and doing food intolerance testing and removing those
Mm-hmm.
foods, that the psychosis really lifted for people.
Yeah.
And so it really just depends on how long somebody has had it, how deeply um, affected they are, how well they've been managed too. And I find that the more work that you can do on the dietary piece and working with the gut, the microbiome too is another piece
Yeah.
of this puzzle. It's very complex, and I think in not every schizophrenia case have I had has there been trauma, but in most of them there is some sort of trauma.
And
Um,
by trauma, you mean?
so either, like, I can think of one case, he had severe bullying, like very bad bullying. Another was abused by his father. Another was sexually assaulted.
Mhm.
So those kinds of
Right,
forms
we
of
forget
abuse.
about this. I want to say softer, and that's the wrong word.
Well,
Um,
there's you mean
le-
in terms of trauma,
yes,
like big T and little T? Yeah.
right. But trauma also is on a spectrum. So,
Yeah.
and to me, it's always the interaction between the trauma and um, the person that um, I think they use diathesis as the word, for lack of a better description right now.
Yeah, well, and do you know Dr. Gabor Mate? Have you heard of Gabor Mate?
I'm
Yeah,
embarrassed to say that I can't tell you more.
yeah, that's okay. So he talks about trauma in this reference, that trauma is not what's happened to you, it's what's happened inside of you as a result of that particular event. So it's how you have perhaps shut yourself down, or closed yourself off, or suppressed emotions, or
Mhm.
something. So it's not, I used to think of trauma as sort of the event,
Right.
that it's the event, but that sort of shift was helpful for me to learn that it's more about how you have processed it, or what you've made it mean for you as an individual.
And I think that means physiologically as well,
Hmm.
in addition to just how you
Yeah,
perceive it, but how your body processes it, going back to your model.
that's right. Yeah, and one of his books is called When the Body Says No.
Mm,
Yeah.
that
So it's
is wonderful. Now, I know we're running out of time, or time for this interview, not running out of time in general. Um, if you had, I hate this question. I love this question. In med school, we always have the take home message.
right.
People listening and watching, if you could have them remember, at a minimum one thing, what would the most important thing be that you would like people to take away?
I think the most important thing for me is really for people to understand that no matter what the label it is that you may have been given, or that you're feeling ashamed of, or perhaps stigmatized by, that you can learn to manage your mind so that you're not at the mercy of it. And the 10 steps that I talk about in Beyond the Label are really a foundational guide to help get you there. So just know that what you're experiencing now doesn't have to be the way it's going to be for the rest of your life. And starting from this moment on that you've listened, you can make a new choice in every single moment with every single breath. So make a decision for yourself. What are you going to do? If you want to show up differently tomorrow, or you want to show up and have a different experience tomorrow, you've got to do something differently today. And so that's the gift here, is that there's so many things that you can do, whether it's simply going for a walk in nature, or finding those tryptophan forming foods and getting them into your diet, or getting off your device, right, 2 hours before bed. So do something different, so to have a different experience tomorrow. So that was more than one thing, but
no,
I just
no,
have
no,
to
no,
say.
no. I've loved listening to you. You have more than one book. So one book is Beyond the Label, and you have two more books.
Yeah, so Beyond the Label is the big book here. I'll just put it up there if people are going to see it. So Beyond the Label.
Too.
Yeah, and then there's the Essential Diet, Eating for Mental Health. So I broke that out. That's in Beyond the Label, but I broke it out into a separate guidebook for people who just wanted that diet piece. Because some people, it's a bit daunting. It's like, well, where do I start with all of this? Right? Well, just maybe start just with the diet. So that's called the Essential Diet, Eating for Mental Health. It gives you the 2-week grocery shopping list. It gives you all the recipes to eat that you should be eating to support you from a nutritional perspective, to support your mental health. And then the third book is a companion journal to Beyond the Label. It's called Moving Beyond, a Journal into Self-Discovery. Oh. So I mentioned I'm big into journaling. So
yeah, I think I know my Christmas gifts for this year.
Yeah, thanks.
And if somebody, again, just because I can't feign my deep like or resonance with what you're saying, if somebody wanted to work with you, how do they go about that? Or if they wanted to learn more about you?
Yeah, probably the best thing is to go to my website, which is drchristina and then bjorndal.com. I won't spell it, but you'll see it in the name.
We'll make sure it's.
Yeah. And so I have a 10-week program that's there that's helpful. It's a really, it really guides you and takes you deeply in depth into these 10 steps. And there's 2 options or 3 options in how to participate in that. So you can sign up for it and do it at your own pace, or you can sign up and then have calls with me, or you can go through a weekly live session with me. So those are the 3 options with that. And like the one-on-one piece of the puzzle is a bit challenging because my practice has a big wait list, and so that's why I'm kind of encouraging people to use these program options that are available. So that's but definitely check out the website. And
you have a free gift for our audience, and
yes,
okay, and I have all the information that will be prominent.
Yeah, basically it's just a step in forgiveness. It's a meditation, and really, for me, it was a wonderful healing tool. And I actually do it once a month just to see who shows up when I do this meditation. And you'll know what I mean or what I'm talking about when you do it. It's a really nice meditation that helps, because forgiveness, when you have a mental illness or have been through some of the things that I've been through, sometimes there's some casualties along the way. And so you have to kind of work through.
And let me reiterate, that's also just part of living and being human.
Yeah. So we are all, we're all navigating, this journey, and we're all, sometimes we're triggered, and so this has really helped me to let go of things that I don't need to carry anymore. So I hope it serves you well.
I'm sure it will. So again, thank you very, very much. And I look forward to keeping in contact with you and hearing more about what you're doing.
Yeah, thank you. Thanks for having me.
Bye now.